Coronavirus or coronavirus Latin, Orthocorona are viruses that cause diseases in birds and mammals and form one of the two subfamilies of the Coronaviridae family. While the virus, which is usually not serious in humans, causes significant number of catarrhal cases, some rare coronavirus variants, including MERS, CoV, SARS, CoV, and COVID-19 2019, nCoV, can cause respiratory infections with risk of death. Coronaviruses cause diarrhea in cows and pigs and upper respiratory diseases in chickens. The genetic material genome it contains consists of single-stranded RNA with positive polarity. They are viruses with the largest RNA genome ever detected, with length greater than 30 kilobases. The most prominent feature of the virus, which is 125 nanometers in size, is its stick-like protrusions around it. With this feature, it is named as coronavirus under the microscope because it looks like the sun's crown Latin, corona. The statement made by the National Biotechnology Group was glimmer of hope. An important step was taken with the new medical study against coronavirus. Antibodies from disease survivors were used for 10 patients, improving patients' conditions. Antibodies in the blood of survivors were determined to destroy the virus. The body temperature of the patients began to drop, their vital functions improved significantly. Discovery coronaviruses were discovered in the 1960s. The first discovered viruses include infectious bronchitis virus seen in chickens and two types of viruses that are taken from the nasal cavities of human patients with symptoms of colds and are named as human coronavirus 229E and OC43. Later, many new types of coronaviruses have been discovered, including SARS coronavirus discovered in 2003, HCOV-NL63 identified in 2004, HKU1 diagnosed in 2005, MERS, CoV noticed in 2012, and COVID-19 of Wuhan origin. Most of these viruses cause serious respiratory infections. Morphology: coronaviruses are large, pleomorphic and spherical particles with protrusions on the surface. Virus particles have diameter of about 120 nanometers. The viral envelope of the viral envelope is visualized as an electron-rich shell. The viral envelope of the coronaviruses consists of double-layer lipid layer, with membrane M, envelope E and spike S proteins. Certain coronavirus groups, especially in the betacoronavirus subgroup, contain hemagglutinin esterase surface proteins that are similar to spike proteins, but are shorter. The nucleocapsid consists of many positive-oriented and single-stranded RNA-bound nucleocapsid N proteins. Human coronaviruses are thought to be responsible for significant proportion of the catarrhal cases in adults and children. This group of viruses causes symptoms such as fever and enlargement of the tonsils and most often causes colds in winter and early spring. In addition, coronaviruses can cause pneumonia and bronchitis, viral or secondary bacterial. There are different human coronaviruses. Human coronavirus 229E HCOV 229E, human coronavirus OC43 HCOV OC43 SARS, CoV, human coronavirus NL63 HCOV NL63, Haven coronavirus, human coronavirus HKU1, MERS coronavirus MERS, CoV, new coronavirus COVID-19 HCOV 229E, NL63, OC43, and HKU1 viruses cause respiratory infections in children and adults worldwide among the human population. Severe acute respiratory syndrome SARS is respiratory syndrome caused by the SARS coronavirus in humans. The SARS outbreak that spread from Hong Kong between 2002 and 2003 has almost become pandemic, causing 8,422 cases and 1,524 deaths worldwide. The World Health Organization announced the mortality rate as 10.9%. MERS, Middle East Respiratory Syndrome (MERS), is coronavirus infection that was first detected in Saudi Arabia in 2012. 36% of patients infected with this virus die. Shortness of breath, cough and fever are among the most important symptoms of the disease. Some bodies can overcome the disease with mild symptoms. There is no risk of disease survivors transmitting the virus. Severe acute respiratory syndrome coronavirus, severe acute respiratory syndrome coronavirus, or COVID-19 or Wuhan coronavirus, is Chinese, originated virus of Wuhan City, first reported in 2019. The speed of transmission of the virus, which can be transmitted from person to person, accelerated in mid-January 2020. The incubation period of the virus is 14 days. It is estimated that the mortality rate seen in individuals infected with the virus is below 3%. Russia was the first country to support vaccination studies. As of 16 March 2020, 152 cases, 6,496 deaths and 114 analyses.